Hi, everybody. We're back for Mind and Scalpel with Dr. Kenneth Rothaus and Alexandra Janelli, your founders down at Modrn and Rothaus Plastic Surgery, here to bring you another informative tutorial, blog, whatever we're calling this, on this new treatment that Dr. Rothaus just finished doing a whole study on called CoolPeel. And I am excited to learn about it because I must admit, I don't know too much, but I have seen some of the results that you showed me from the before and afters, which we will also be posting onto our Instagram feed. So make sure you check them out. But Dr. Rothaus, let's talk about CoolPeel because it is new to the market and we're going to start seeing it more and more. But you're one of the unique doctors who are doing it right now. But let's start with the basics. What is CoolPeel?
So great. Well, thank you for the question because the study was very exciting. And it was actually, we were looking at CoolPeel in conjunction with another device called the SubZ Cryo. So it was a cooling device in order to make the CoolPeel an even more comfortable procedure than it already is. And we were analyzing if it made a difference or not. And it did, but we can get into that. But basic CoolPeel is a type of laser that does skin resurfacing. It uses a unique proprietary way of delivering the laser energy so that it treats the epidermis and the very, very superficial part of the dermis. Remember, your skin's divided into three basic layers. The superficial layer is your epidermis. Your deeper layer, the dermis, is divided into papillary and the deeper reticular dermis. And a lot of devices can go into the deepest part of the dermis. The CoolPeel delivers the energy in such a way that it treats just the epidermis and the upper papillary dermis. So why is that important? Well, it's important because it means that you're going to heal faster. You're going to get results and heal faster. Some of the other things that go into it, without getting too technical, it's also the way the energy is delivered. You don't have as much heat damage around each of the laser beam treated areas. Okay, so that means also you're going to have less redness and you're going to have a quicker recovery. The CoolPeel is a fractional laser, and I think in another talk we can go into what's the difference between fractional and non-fractional, difference between fractional lasers, fractional radio frequency devices. But basically, in a very simplistic description, in a fractional laser, you're only treating a small section of the skin at a time. Maybe you're treating and you can dial it in. So you can dial it in from treating like 1% of the skin to treating 99% of the skin. In reality, most of the time, we're treating somewhere in the range of 7 to 10% of the skin, maybe 7 to 9% of the skin. But if you think about it, how do you do that? It's sort of like a checkerboard pattern, or even better yet, like a wine rack. If you looked at a wine rack full of bottles, the little caps, the little black wax on the end of them, that's the only part that gets treated. All the rest of the space, so the wood and the space around the bottle, is not treated. So what that means is you get to heal faster, but you have a lot of untreated skin around it, so the wounds heal very quickly, but you still get the results. So then to simplify this, the CoolPeel is a state-of-the-art, sophisticated CO2 laser that is a fractional delivery of the laser light that is useful for people who are tired of how their skin is looking because they see too many brown spots. It's sort of lost its tone. They have fine acne scars or wrinkles. Their pores are starting to get bigger. They see all these changes from aging and the environment. And honestly, most of the people in the study were either millennials or they were very early Gen X, right on the border between millennial and Gen X. And because these changes are not just for boomers, they're not just for your parents, but everybody's are seeing these changes in their skin. And in the study, we only did one treatment with CoolPeel, but what was interesting, we took the SubZ Cryo, and what that basically is, it's a machine that delivers cold air very forcefully. And we measured the patient's skin temperature with it's called the FLIR gun. You've probably seen it on, like, TV shows. It measures heat. You see the bodies running through the house. So it's very similar. We use it a lot in medicine now in resurfacing. So we measured the skin temperature before we started, and then we cooled down half the face, about 10 to 12 degrees centigrade, and then on one side, but not the other. And then during the procedure, we treated both sides with the CoolPeel, and the patients recorded if it felt more comfortable, the same, or less comfortable on the side that was cooled. And basically, nobody thought it felt worse. Everybody thought the procedure itself, even without cooling, was relatively comfortable. Sort of felt like stinging or little needles, but most people on the CoolPeel side said it was really much more comfortable and was a very easy procedure. We also cooled them right afterwards on the same side, and then looked to see if there was less redness. And some of the people, we got really, really dramatic pictures of how there was less redness. I was very but the redness, but that finding was immediate, but most patients didn't see that it stayed the next day. What I was very pleased about was, because it's usually we do this as a series of 3 or more treatments, and we don't really photo them on a single treatment when they first come back, one treatment. And I was fairly amazed how happy the patients were. Ecstatic would be almost a better word, on how their skin looked after a single CoolPeel treatment. We had some really nice photos. You can see their pores are smaller, their skin is shinier. One patient sent me an email this weekend, said, I just had a Zoom with my mother, and we Zoom every week. And she said to me, your skin looks so good. What did you do? So I thought that was pretty cool. Anyway, that's what the treatment is. The treatment is it's an ambulatory treatment. We do put a topical anesthetic on for about 15 minutes just to help a little bit with the sting. There's really almost no downtime to the procedure. All the patients were instructed they could put makeup on the next day if they wanted. They all went to work the next day. They said they really didn't see much of anything. So.
Right. So the name is a little confusing on some level, just because it's not a peel, right? It's the non-peel peel. And then
yeah, it's right. Peel is sort of a misnomer in this situation, because people think of peel and they think like a mask is coming off your face.
Right, or your skin's going to come scoffing off.
Right. No, it's
have, right? But this is not that.
It should almost be called a cool laser facial, would be a more accurate description of it.
And cool, okay. That like awesome, not cool as in cold, because that's where the SubZ comes into play. So
right. The cool. So the reason they I think included the word cool in it was, as I described in the beginning, you don't have as much, because of the way the laser light is delivered and goes into the physics of light energy. And maybe sometime we can do a video on what is a laser. And people could really sort of. So basically, it's the way it's delivered. You don't have what we call as big a zone of thermal injury around the where the laser spot hit. Okay, if you think about it, if you burn yourself, let's say you touch the a hot pot. Okay, well, you could touch the hot pot and you get your little ping, but you don't blister or anything, and you did something and you could feel it. So you've thermally injured your skin there, and you've injured it to the point where something's happened and the body's reacting with redness and things like that, but it sort of goes away quickly, okay? Versus where you blister or you really create an injury. So with the laser, what we're doing is we want a zone of thermally injured tissue, just like when you touch the pot and it went red, but it didn't blister, but we don't want thermally damaged tissue. So in the CoolPeel, the thermally damaged tissue is really limited to the exact spot of the beam, and the zone of thermally injured tissue is smaller than you might see with some of the other devices, and that accounts for the rapid recovery.
Very cool. I guess my last question on this is, of the more common treatments people have been using to do facial resurfacing, what should they consider? Like, meaning, like I would think if I were doing resurfacing, maybe it would be microneedling. So if they were considering doing microneedling, this might be a good alternative. What other things would this maybe work in place of?
So microneedling is really just purely a mechanical injury. So you're trying to stimulate collagen and a healing response just by a mechanical injury. Okay. This is an ablative laser. So it actually takes out a very, very, very tiny column of tissue and creates a thermal injury as well. So you have both mechanical and thermal. There are other quote resurfacing type of modalities such as non-ablative laser resurfacing, where we just create a column of thermal injury with no loss of tissue. There are radio frequency devices that use needles or pins that also are used for the same thing. And of course, there are chemical peels and other mechanical devices like microdermabrasion. There's the Hollywood peel that uses pure heat energy. So there's a ton of stuff. But I know that we don't. Nobody wants to listen to a 2-hour video blog of me talking, but maybe we can divide some of those topics up in shorter blogs because they're all really topics on their own.
If people were considering doing a peel or this other things that you just mentioned, this would be a great thing to look into as an alternative with really great results too.
Absolutely, and we often combine it with fractional radio frequency, which goes. We put those needles. Those needles go deeper, and the device we're using, the Virtue, has an insulated needle. So with the insulated needle, you can create a very focused zone of thermal injury deep, and the CoolPeel can create it superficially. So you'll get more results with that as well.
Amazing. That's what all us want we just want the results, right? And I think Dr. Rothaus,
Exactly.
from all the treatments that you've really curated and put together, it's not just about what's cool on the market, it's what results are coming from them, which is why you actually haven't brought in some treatments and have done others. So I always respected that about you, of really finding the treatments that get results and not just because they're popular on the market. So
Well, and also, not all popular treatments are necessarily good for all patients. Okay, so you basically, I think, the fairest thing is you have to have a range of treatments available, and based upon knowledge and experience, be able to offer the patient what is best in their situation.
which you can do because you've got a whole toolbox. You're like a carpenter.
That's me. Well, surgeons. We're just carpenters.
Exactly, body carpenters.
Exactly.
Well, thank you so much for offering that. If you're interested in checking out the videos and pictures, the before and after of the trial that Dr. Rothaus put together, please feel free to check them out on both of our Instagram feeds. And if you're looking for a consult, you can find information in the comments below of this blog post and how to get in touch with us over at Modrn and Rothaus Plastic Surgery. Signing out till next time.
Bye-bye. Thank you. Thanks a lot. Have a good night.
Bye.